Tom, what's the role of an ethicist in mental health setting, and what does a day in the life of Dr. Thomas Foreman look like?
So good morning, everybody. Are you able to hear me?
Yeah.
Great, good. So what is the role of an ethicist in a mental health setting? And this is an interesting question in terms of the role is varied and never the same thing twice. So generally speaking, we as ethicists serve in an advisory and a consultative capacity. For example, all of you would be familiar with the various complexities in the lives of the people that you work with and that you serve. And sometimes in those complexities you'll run into clashes of values or clashes of desires and wants with your clients and the people that you work with. And so one of the things that ethics does in a healthcare setting is help clinicians and people who work in complex situations tease out what might be the best approach. And a good example of that may be, you all work for the best interest of the person that you're working with in the moment. The challenge is, how are you defining best interest in that moment? What does best interest mean? How do I advocate for their best interest? Do what they believe to be their best interest is what the system believes is their best interest, what you might believe is their best interest. And so ethics can help navigate through some of those gray areas in terms of, you have a sense of what you think you might want to do in terms of an approach, but there is also another alternative. Which one should I choose, and why should I choose? And the why question is really very important from an ethical point of view, because you can act in every instance. The question is, why have you chosen to act the way that you've chosen to act, and is it consistent with the best interests of the individual, the best interests of the system, and as Kendra will talk about, and in line with the law, right? And so, and in terms of what a day might look like, ethicists really focus in four major areas across the board. One is clinical consultation or direct frontline consultation. So in that sense, ethicists are available to clinicians, they're available to patients, clients, and they're available to their families to talk about navigating through complex issues. So the clinical consultation piece is one. We also do education. We do events like this. We may do education for medical students. We might do education for university students from other health professions, educate the public on issues that would be relevant to them. We also involve ourselves, or get involved in, organizational ethics issues and policy issues. And this one is one that you're all going to be very familiar with. In terms of, we have a limited amount of resources available in the healthcare system. How do we choose to spend the money that we choose to spend it on? And when you think about it, yesterday there was a big announcement, right? The province is going to be spending a whole lot more money on healthcare. Well, why was that decision taken? How is it being resourced and directed? We certainly know that mental health has historically been under-resourced and underfunded. Now we're seeing a shift in focus to more resources and more funding. The challenge is in the system. Somebody did not go out and print $100 million new last night to add that money to the pot of money that's available. So that money has to come from somewhere. Where is it coming from? Is it being diverted out of another program? And if it is, why? So who are the haves and who are the have-nots? And also that we think about it from a policy point of view, advising on both public policy but organizational and institutional policy around issues such as smoking, such as visitation, if you're in an acute care setting, right? Well, who gets to visit, how many people to get to visit, how long do they get to visit, those types of things. So we do the consultation, the education, the organizational ethics piece, and then if you happen to work in a setting where there's research being done on human subjects, we also help to oversee the research piece and look at the ethics of research. So again, if you happen to be a woman, you know that historically women of childbearing age have been excluded from participation in research projects. Is that appropriate? Should it be appropriate? Why does that happen, and is there an alternative? Is there a different way to approach that? And so that in a nutshell is what we do, and in terms of what my day looks like, it looks like all of that. Right? So when I walk into work in the morning, I may have a clinical consultation. I might spend some time working on a policy. I certainly may do a rounds or some education event, or go to a research ethics board meeting. So on any given day, I can be engaged in a wide variety of these activities. My schedule doesn't generally tend to be set. The great thing about that is no 2 days in my life look the same. So I get to enjoy something new every day.
Great, thank you so much. Is there an ethical framework or a particular approach that is applied when supporting clinicians or administrators in mental health care?
So I'm going to start by saying Lou has unrealistic expectations. When you ask a philosopher a question and then you tell them they have 2 minutes to answer it, those are called unrealistic expectations. So there's half of my time. Now, having said that, there are a variety of ethical decision-making frameworks that are available out there. And they'll come by a variety of different names. Some of them you may have heard of in the organizations that you work with. If you work for an organization that is accredited through Accreditation Canada, one of the requirements is that they have an ethical decision-making framework that they utilize. So if you do work in one of those types of organizations, it would be valuable to ask the organization what exactly that framework is and how it's utilized. One I can talk about that we use at CAMH and other types of organizations, and if you are in a community that, an organization that works with the CCAC, and you're part of the Community Ethics Network through the CCAC, this is actually a model that was developed by them, and we call it the IDEA model or the 4-box method. And essentially, the goal is that with an ethical decision-making framework, you shouldn't necessarily be expected to apply it and utilize it on your own. It's really a tool that you should be able to use with a team, or if you have access to an ethicist, have an ethicist do a facilitated discussion around applying it to a particular case. The basics of most ethical decision-making frameworks focus on 4 areas. One is establishing, the first thing we want to do is try to establish the facts. And all of you who are working on the front lines realize that the facts are not as easy to establish as it might sound on the surface, because everybody thinks they have their own understanding of what a truth is in this situation. And when you have 3 or 4 people with 3 or 4 different understandings of the truth, what is a truth in that sense? And so the first thing we want to try to do is establish the facts. Then we want to layer on top of those facts contextual features. Is the individual living in precarious housing? Are they homeless? Are they new to Canada? Are there language barriers? Are there sociocultural characteristics that we need to concern ourselves with or think about? Are there faith-based characteristics? Are they racialized populations? And so once you have the facts, you then want to layer on all the context, or another way to describe that would be the narrative of the person's life. Right? What is this person's life looking like? And in light of the facts, what are the impacts on those contextual features? Then we would move through to look at, are there really ethical issues present? We want to identify what those ethical issues are. And it may seem initially that, oh yeah, there's lots of ethical issues here, when in fact they happen to be legal issues, right? And so they're a matter of the law. The law says you must or you must not or you shouldn't do A, B, or C, or you should do. So it's really maybe not an ethical issue. It may cause you some distress because the law may require action in a particular way that you find distressing to some degree. But if there are indeed ethical issues present, we will tease through those ethical issues and look at what they are. Are there competing ethical issues? What's in the best interest of the client? What's in the best interest of the client's patient or our client's family in this context? What's the best interest of the community if there are risks to the community? And so we want, if there are competing or multiple ethical issues that may bump into one another, we're going to tease that out a little bit and prioritize them. And finally, then the last thing we would do is we would act on what we thought was the most appropriate approach moving forward in the context of the facts, the contextual features, and the various ethical issues at play. We then would want to act, and importantly, we want to evaluate afterwards whether our action actually got us to where we wanted to be, because if it didn't, we may want to do a debrief and say, okay, how might we do this differently the next time so that we get a different outcome. So that in a nutshell are
Thank you, that was impressive. You were able to condense basically a doctoral degree within 2 minutes there, I appreciate that.